Do you feel stressed, anxious, and mentally exhausted most of the time? What if I tell you that there is a natural mechanism God has given you inside your own body to control the stress? What if I tell you there is a switch in your body which can change you from a stress mode to the calm mode within few minutes or within few seconds? I'm talking about vagus nerve, the term which most of you may not even have heard of. Vagus nerve stimulation is a wonderful buzzword nowadays to control the stress naturally. Vagus nerve stimulation can make you mentally calm, relaxed, and focused. Scientists call this vagus nerve as a natural relaxation technique. But can the simple stimulation of this vagus nerve really make you calm? Does this really work? And why this vagus nerve stimulation is the new buzzword in the neurosciences today? I am Dr. Rajat. I am a consulting gynecologist and infertility practice. And in my practice, I encounter stress-related problems very frequently. Infertility in 90% cases is stress-related problems. And while I have over the years counseled my patients to control the stress, I find vagus nerve stimulation a very, very important method to reduce the stress. In this video, I'll tell you about the evidence-based methods, how to do a vagus nerve stimulation, how to do it effectively to reduce your stress, to make you more mentally calm, relaxed, and mentally more resilient. By the end of this video, I promise you will know all you want to know about vagus nerve. What is vagus nerve? Where it originates? How it functions? How to stimulate the vagus nerve? What are the things you need to do to stimulate the vagus nerve in an effective, optimal manner so that you become emotionally, mentally, and even physically relaxed? Hi, I'm Dr. Rajat and you have started watching our YouTube channel, The Fertility Gynecologist. If you are staying present and grounded, calm, focused, and happy, that means vagus nerve is running the show. Vagus nerve is responsible for the rest and digest, and this is what allows us to relax. But if you struggle with stress, anxiety, you are likely to have a low vagal tone. You must have heard about gut feeling. What is this gut feeling? Gut is basically our intestines. Intestines have got 90% of our nervous system. This is also called as an enteric brain. Enteric means intestine, brain means this thing. So 90% of what we think is basically originating inside our abdomen, inside our intestine, and that is what is gut feeling. And this gut feeling, ladies and gentlemen, my dear friends, is what vagus nerve is all about. It is a potential switch-off mechanism for most of the emotional, mental, and the inflammatory disorders. Almost every disease has its origin in inflammation, right from rheumatoid arthritis, diabetes, to blood pressure, heart attack, brain strokes, you name any disease, there is an inflammation involved, and vagus nerve has got a definite ability to control the inflammation. Before I delve into the details, let us first understand what is this vagus nerve. There are two systems in our body. One is a sympathetic nervous system, one is a parasympathetic nervous system. Sympathetic, God has designed these systems. They are autonomic nervous system. That means they are automatic. They are not under our voluntary control. Everything right from our heart rate, pulse, urine, saliva, mucosa, speech, respiration, everything is automatic. We don't do it. Like if I'm moving this hand, it is under my voluntary control, but the way I am breathing, the way I am speaking, or the way I am humming, my digestion, my secretion of saliva, my urination, everything is under autonomic control. And this autonomic system is having two things. One is which stimulates the autonomic system is called a sympathetic nervous system, and one which calms the autonomic nervous system is called as a parasympathetic nervous system. I'll give you an example. You're walking on the road and you suddenly see a snake or a tiger or a lion out of nowhere. You'll have two responses at that point of time. Either you will think of fighting that person or a snake or tiger, or you will think of running. So this is a typical flight and fright reaction. And this is what sympathetic nervous system does. The moment you think that there is a stress which your body thinks this is harmful for you, then you either fight that, your body will increase, your heart will pound, you will have more perspiration, you will breathe heavily, shallowly and quickly, or you will try to run away. So sympathetic nervous system has a propensity to increase the energy for that particular point of time, and the moment that acute stress event has passed, the snake has gone, the lion has gone, or you have fought, killed it, whatever, or you have run away, and then when you think that you are safe, your body thinks that you are safe, at that point of time your heart rate will come down, you will no more have perspiration, you will breathe heavily, slowly, and your breath will become normal. That is when the parasympathetic system will take turnover. This is called as a rest, digest, and a relax response. So parasympathetic system stimulates your flight and fright response. Sympathetic system stimulates your flight and fright response, and parasympathetic system stimulates your rest, digest, and relax response, and which is ultimately responsible for our well-being. This parasympathetic system has got a main nuclei in our brainstem, that is in pons, that is called as a locus coeruleus, which terminate in the nucleus tractus solitarius, and it sends fibers to the various parts of amygdala, thalamus, cerebellum, spinal cord, hypothalamus, orbitofrontal cortex, and thereby causing the arousal. If that stress occurs for a short time, then it is healthy. But if that stress occurs for a long time, then it suppresses our immune system. But if there is a chronic, low-grade traumatic stress, which unfortunately most of us are handling nowadays, this is what causes our immune system to go haywire. And that is the trigger in most of the cases for autoimmune diseases. That is the trigger for thyroid problems, for ovary-related problems, kidney-related problems, joint-related problems, and even heart-related problems in most of the cases. And therefore, vagus nerve stimulation acts to decrease this inflammation, which I'll allude to it in the later part of the video. Vagus is basically an information superhighway to the brain. It has got 20% of afferent fibers and 80% of efferent fibers. Afferent means it goes from periphery to the center, and efferent means it goes from center to the periphery. Afferent means whatever happens to the body, whatever we are listening, seeing, smelling, feeling from all the senses, that information goes to the brain. And brain means the vagus takes it to the brain. And this then acts from the afferent. Efferent has its action on both somatic and the autonomic nervous system, so it will act on our muscles also, it will act on our larynx, throat, gastrointestinal tract, everything. Vagus basically plays multiple roles in our body. It plays a role in digestion, it plays a role in maintenance of our breath, breathing, in role in our cardiovascular system, that means maintenance of blood pressure, heart rate. It affects how we behave, our mood. It affects our mucus secretion, urine secretion, it affects our speech, it affects our taste, and almost urine immunity also. What is this vagus nerve and where does it arrive? How it passes? Vagus is basically the largest cranial nerve in our body. It is the 10th cranial nerve, and vagus in Latin means meandering. It arises somewhere in the medulla oblongata. It is a very thick nerve. From there it goes to the neck, then to the throat, then to the chest, lungs, heart, from their diaphragm, and to the intestine. It branches everywhere. The superior ganglionic branch supplies to the spine and the ear. The inferior ganglionic branch supplies to the throat and pharynx, and thereby the voice modulation. And the proper vagus nerve supplies to the lungs, heart, and the diaphragm. And that is why it is called as an unconscious brain. It can talk directly to the body. Your body can talk back without requiring your attention. It can make instant adjustments without even you realizing it. And that is where the heart vagal tone comes. When you are grounded, present, engaged, and level-headed, that means you have got a high vagal tone. And high vagal tone means that you have a high capacity for stress, change, and challenge. You have a high capacity for rest, recharge, and recover. People who have got a low vagal tone, they have got a low capacity for change, challenge, and stress. They do not recover easily, they cannot rest easily, and they even recharge less easily. They are more irritated. They find everything overwhelmed. They get overwhelmed by almost many innocuous kind of condition. And that is where you need to increase your vagal tone. Vagal tone, like I had told, vagus is stimulated by various interoceptive stimuli and interoceptive. So whatever you hear, whatever you feel, whatever you sense, whatever you think, it goes to the brain. What are the signs of low vagal tone? This is very important. People might say, I cannot feel anything, all reports are normal. But like I mentioned, because vagus controls autonomic nervous system right from the taste, speech, digestion, breathing. So most of the people who are having an abdominal pain, bloating after eating, without eating, they have got low vagal tone. Most of the patients who have got acid reflux, acidity kind of things, gastroesophageal reflux disease, they have got a low vagal tone. Most of the people who have got a palpitation problem, their heart rate increases at the drop of the hat, the blood pressure problems, either low or high. Most people, they faint very easily, they feel dizzy, they have a low vagal tone. Most of people have low appetite, unexplained weight loss, even unexplained nausea, vomiting, for which no explanation can be sought. These people have got, they are symptomatic of a low vagal tone. So the question arises, how to increase this vagal tone? Vagus nerve stimulation is a very important buzzword in the neurosciences today, because vagus nerve God has given you to control your stress by itself, and this can be controlled in many ways, either by nutrition or by exercise or by psychological things. But thing is, the vagus, when you stimulate your vagus nerve, you cannot find or you will not appreciate changes. If you do it right now, you may not appreciate the changes today, tomorrow. The changes of vagus nerve stimulation may take time, 6 to 12 weeks. You have to be consistent, you have to be persistent, you have to be honest, and you have to be sincere with all those things. You try one thing at a time. Try it for 3 to 4 weeks, and then while still trying that thing, while doing that thing, add another thing. So in 6 to 8 months, your vagal tone would increase. Like I have said, the vagal nerve has got a direct and an indirect connection to cortical, thalamic, limbic, striatal, neural pathways, which are connected to cognitive and emotional aspects. And that is why vagus nerve stimulation affects the main norepinephrine center, that is locus ceruleus. Whenever there is an inflammation in the body, because of the interoceptive and the enteroceptive effect of the vagal afferents, which are 20% of the fibers, that inflammatory knowledge goes to the vagal nerve, and from the vagus efferent it activates a vagal anti-inflammatory reflex, that is cholinergic anti-inflammatory pathway, CAP. It secretes acetylcholine, it secretes oxytocin, and thereby decreases the inflammation in the body. There are various natural ways to improve the vagus nerve. Like I said, it can be done by nutrition, it can be done by exercise, it can be done by psychological factors. Well, details I'll discuss later on in the video. Let me go read through the ABCD of vagus nerve stimulation. First and foremost step is alternate nostril breathing. You do a simple Anulom Vilom, Pranayam, Nadi Shodhan. It definitely stimulates your vagus. Apply cold compress, apply ice cold water or an ice pack on your face. It will stimulate the vagus nerve. Be quiet in this era of internet, TV, everybody is constantly saying something. Please be quiet. Please compliment others. Please connect with the nature. We have forgotten to go out in the sun. We have forgotten to go out in the gardens. Go to the lakes, the mountains, the gardens, the sunlight. Sunlight is a good source of not only managing our vitamin D levels, it also helps with our circadian rhythm. Breathe, deep breathe. Do a diaphragmatic breathing. Eat whole food. Unfortunately, we are eating much more refined food nowadays. We have to make a habit of eating whole food. That is very important. Not the processed and the ultra processed foods. Exercise. Most of us have forgotten to exercise. We are meant to walk more and more. We use two-wheelers, four-wheelers instead of walking. We use lift instead of climbing stairs. We don't run. We don't play anymore. What we play is on our PlayStation. We play on our mobiles. That is a big no-no. Exposed to the sunlight, to the natural air. Have an attitude of gratitude is very important. Everybody wants what we don't have. We don't appreciate what we have. We should thank to the God for what we are having. At least we are better than almost 90% people in this world. We have a roof on our head, we have food to eat, we have bed to sleep, we have got a family. We have to be thankful to the God, and this attitude of gratitude is very important. Hum. In old days, people used to hum a song, a hymn or a mantra. Laugh and giggle often. Many people accuse me of forgetting to laugh. I personally know I have forgotten to laugh, yes. But you have to laugh without a reason, and that is why you watch comedy shows, you play, you enjoy with the family. Listen to a soft instrumental music, not those loud and this. Sing any kind of bhajan, song, hymns, prayers. They activate your vocal cord, and vocal cord is which is supplied by a recurrent laryngeal nerve, which is a part of a vagus nerve. Any kind of massage, a superficial soft tissue massage, full body massage, neck massage, foot massage, head massage, it helps wonders for stimulating the vagus nerve. Meditate. This is very important. While a total 100% meditation may be difficult, but at least try and make an effort to meditate. Pray. Pray is very important. Pray not only for yourself, pray for your family, pray for others, even pray for your people whom you don't like. This praying calms your mind. When you are having a low vagal tone, you are having frazzled nerves. You are like a cat on a hot tin roof. You are stimulated, instigated by everything. When Vegas is running the show, you are calm. You are in the Zen mode. You don't react to the situations easily. You can think clearly. You don't have a foggy thinking. You are able to make decisions in a more clarity and thoughtful manner. Move your body, exercise. Don't be sitting. Sitting is the new smoking. The more you sit, the more tight your muscles become. Like I said, human beings are meant to walk. Human beings are meant to run. Our ancestors were hunters, gatherers, and they used to have, they didn't know what stress is. Say thank you often. We have forgotten the gratitude aspect. We take things for granted. We have to appreciate the small efforts from people. Smile as much as possible. A smile uses less muscles than a frowning, and a smile works wonders. Take good amount of pro and prebiotics both in natural forms and in supplements form. It takes care of your gut. These are various things. Now I'll come to it, each one in detail. Breath work is the cheapest, easiest, and the most effective way to stimulate your vagus nerve. You basically breathe with intention. Like I said, we breathe because we don't know. It is an autonomic process. We don't breathe it. But most of us make few mistakes. Most of us breathe very shallow, and most of us breathe with chest. So when we are breathing, the shallow breathing, the oxygen comes only up to the chest. We are not using the abdomen part of our abdomen for breathing. And when we are stressed, we tend to breathe through the chest. The abdomen is not used, and we are basically hyperventilating. There is not enough oxygen in the body. There is more CO2 retention. The exchange of gases does not occur properly. More CO2 means the more acidic pH in the body. More acidic pH means we are more prone to most of the disorders in the body, especially mental, emotional, and even cancers. I'll make a detailed video on deep breathing techniques and breath work for the stress relaxation purposes, but let me be very clear. A normal human being breathes at about 14 to 16 breaths per minute. If we can slow down that breath to about 5 to 6 breaths per minute, one breath means a cycle of inhalation and a cycle of exhalation. Inhalation and exhalation, one cycle is equal to one breath. So if we can make that inhalation and exhalation cycle combined to about 10 to 12 seconds, that means we are breathing only about 5 to 6 times a minute. That will stimulate our parasympathetic nervous system, that will stimulate our vagus nerve, that will give us a sense of calm, relief, decrease our anxiety. We will feel safe and grounded. Also, while we are doing this deep breathing, try and see from your mental eyes that this breath is going in. You are holding the breath is going in towards your lungs, and then when you hold it for a few seconds, then try and slowly exhale. You try and imagine, try and visualize that this breath, this air is coming out from the lungs, going in and coming out. But most of people make mistake. When we are breathing, we take our stomach in. On the contrary, when we are breathing, you should take our stomach out, and when we are breathing out, you should take our stomach in. I'll demonstrate to you for this thing. Close your eyes, sit in a strong position. Breathe slowly with your nose, and see on my stomach, when I am breathing, my stomach comes out. It should come out maximum. Make a mental count. Say you have counted till 8, and then hold it for a few seconds, and then slowly breathe either through your nose or through your mouth. I find difficult, but that breathing through your mouth or nose has to be very slow, and while you are breathing, you have to take your abdomen in very, very slowly. Close your mouth, make a pursed lip breathing, or like you are exhaling from the straw. Hold it for a few seconds. Again, make a slow inhalation. Make sure that your stomach is coming out maximum. Ideally, the noise should not be there while you are breathing. Hold it for a few seconds and try and concentrate on the breath. Visualize that breath. Usually the air which goes inside is cool, and air which comes outside is relatively warm. Hold it and try and slowly exhale. If you're counting till 5 or 7 for inhalation, then your exhalation has to be at least 2 to 3 times more. This is very, very important. If you're new to this breath work, count to 4, hold it for 2-3 seconds, and then count to 8 or 12 while you are exhaling. You can do it as many times as you want, but within 5 to 6 minutes, you'll have a strength. sense of calm. You can also do physiologic sighing, like you have taken a deep breath and then again take a sharp deep breath either from nose or from mouth. Make sure when you are doing this your stomach should be out, and then like a straw breathing, slowly exhale over maximum exhalation. Keep in mind when you are inhaling your stomach should come out, and when you are exhaling your stomach should come in. Exhalation should be twice or thrice more longer than the inhalation. This is almost equivalent to doing 5 minutes of meditation. Another method of vagal nerve stimulation is a cold exposure. You must have heard celebrities taking in ice water bath or ice wash on the face. Yes, it is a part of a diving reflex. The moment you dive in ice cold water, the moment that ice cold water touches your face from your chin to the scalp, vagus nerve gets activated. While you do not have to dive into the ice cold water, just take an ice ball, put some water inside it, let it be about 18 to 20 degrees centigrade. You don't have to take 0 degree centigrade water, and just splash your water. Even 4 to 5, 15, 16 seconds splash would be enough to stimulate your vagus nerve. Exercise is a very, very, very important role to play in stimulation of the vagus nerve. Any kind of movement, because like I have said, when you are moving, all your intestines are moving. And the moment the intestines are moving, the 20% afferents from the intro and the interoceptive stimuli, they'll go to the vagus and they will make your body think that you are calm, and that is the mechanism how a walking stimulates your stress response to a calmer level. Even the vigorous exercises like running, like endurance training, they also tend to stimulate the vagus. In fact, a study was conducted in 12 weeks. The rats who exercised, they showed increase in the diameter of axon and myelin sheath of vagus nerve fibers. The diameters of unmyelinated vagal nerve fibers increased significantly. There was an increase in the number of microtubules, the neurofilaments per unit area in the myelinated fibers. Many times when we are doing a long distance runner, the athletes, they reportedly say that they went into the height is because of the vagal nerve stimulation. Mindfulness and meditation is another very important way to relax. Everything is there in our Puranic and the ancient Vedic culture. The Rishi Munis used to do sit and chant Om. They used to deep breathe. Basically, it is another way to connect to the God. I'll make a different video on that deep breathing exercise and an Om chanting for meditation, for vagal nerve stimulation and for the stress relaxation. Probiotics and omega-3 are very, very important. Like I have said, 90% of the vagus nerve is in the intestine, and probiotics play a very, very important role for altering our gut microbiome in a better way. So you should take rotating strains of probiotics. You should take good amount of omega-3 supplementation, and also take prebiotics, all kind of fiber foods. The salads, the cucumbers, the beetroots, the radishes, the spinaches, the tomatoes of the world, the cabbages, they make for a good prebiotic. Laughter is another way to stimulate the vagus nerve. Why do you think Kapil Sharma is being paid so many crores? Because when he makes us laugh, we tend to forget our stress. We tend to go into a different world. Why out I believe is, instead of somebody else making us laugh, we have to laugh. An intentional laughter for 10 minutes, it stimulates our diaphragmatic breathing, it stimulates our vagus nerve. Everybody must have seen Munna Bhai MBBS. The Momen Irani is practicing the laughter therapy, and that is a definite way to stimulate your vagus nerve. You do not have to find a reason to laugh. Please make a session, go in an empty room or a garden or an empty space where nobody would laugh at you seeing you laugh unnecessarily. Try different types of laughter. You can smile, you can laugh, you can burst out in laughter, you can giggle, but do a 10-minute session of an intentional laughter therapy. In many of the interviews, Virendra Sehwag has said that he used to sing a song or used to hum a tune while he was batting. Do you think he wants to become a singer? No. That is a body's response to stress. Some people turn to God they go for prayers. Some people go to bhajans, they sing bhajans themselves. Humming, vocalizing, singing a song, singing any prayer. This does two things. When you are vocalizing, you are humming, it not only stimulates your vagus nerve, it also stimulates your vagus nerve, it also focuses on your breath, and you are gone from your worldly troubles. Massage is another way to stimulate your vagus nerve. Any human body to body contact stimulates your vagus nerve, and that is why If you get a head massage done, you get a face massage done, you get a neck massage done, you get a upper shoulder massage done, a superficial moderate pressure massage, it stimulates vagus nerve. But a deep massage again stimulates your flight and fright response. A simple foot massage can also work wonders. A hugging for a loved one, it has a very, very warm, relaxful and a blissful feeling. What I would like to say in the conclusion is functional MRI studies have shown that vagus nerve stimulation causes a decrease in the activity of areas of brain that produce physiological response to stress and panic. Locus ceruleus, which is located in the pons and has got projections in spinal cord, brainstem, cerebellum and hypothalamus. This norepinephrine, which is produced from the locus ceruleus, has excitatory effect on most of the brain, causing arousal and priming, and that is where the vagus nerve acts. What I would tell you, if even 1% of people start doing this regularly, while you may not expect changes tomorrow, but over a period of 4 to 6 months, doing all those things, incorporating these little things which we tend to forget in the hustle and bustle of our daily lives, the life would become wonderful. You'd not quarrel, you'd not become irritated, you would become calm, zen-like person. I'm a big cricket fanatic myself, and when somebody says Captain Cool for Mahendra Singh Dhoni, I tend to think that yes, he must have been having a vagal now, high vagal tone. He must be doing those things which tend to keep him grounded. You don't have to react to everything. And the breath work, which is the ultimate thing that the God has given us. It is a gift of God. I'll discuss regarding the breath work and stress in the next video. Please like this video, please share the video, and please subscribe to our channel. Thank you.